The food labels are mostly data. And I tried to go on like a no sugar diet last year, and I spent 2 hours walking the store shelves in a Walmart grocery store trying to, and I'm semi-health literate, trying to figure out which foods had sugar and didn't have sugar. It was very difficult. We need to overhaul our food labeling system in a way that is very clear and easy for all of us to read.
And rational and know what's good for them, and that's just not what people are like. And so either you acknowledge the fact that people need some paternalistic guidance and help, or you don't. And when Mayor Bloomberg decides that if people want to have a whole tub of Coke, they have to go get a refill, he gets, and the idea is, people should judge for themselves. And, this is, in the financial world, it's a disaster. Not to mention that President Bush wanted people to have total control over their retirement funds, which was, anybody who does behavioral research simply couldn't believe this happened. And so, this is everywhere we look. It's a deep, deep issue, and you want it doesn't have to be government, it could be not-for-profits, it could be this group. Somebody needs to help people do it right, and the pretense that they can do it on their own has been proven again and again to be a terrible idea.
There's a new company called Help Around. It's in diabetes, why I picked up on it. It's both a global and a local situation. So, if I go into it right now, I can see here in Manhattan who else has diabetes that's in my community. And if I said, oh my gosh, I just took the train up from Baltimore and I forgot my test strips and all out, someone could literally say, hey, I'm going to help you and bring them over. That might sound crazy. It's actually happening. And then it's global as well. And I was blown away as I read this, what people are sharing. I mean, we've moved past people caring what other people hear about themselves, I guess. They're sharing very, very intimate health things on here, and then within 10 minutes they're getting responses from around the world. And I'm reasonably aware of what you should do to manage your diabetes. I've been working in the field for a while. Most of this peer support is really spot on, and if it's not, people self-police and, oh no, that person's crazy, like don't do that. And so an example, and I know Facebook actually just proclaimed that they want to move into healthcare, and that they think the peer-to-peer support is kind of the niche that they can fulfill. We did a demonstration in a type 1 Medicaid population here in New York City, and it was involved a caseworker and a software solution, and the caseworkers told us that towards the end, they said, okay, I've been working with these children for years, and my conversations go like this. They're looking down like this at the ground and mumbling, and we don't have much of a conversation at all. And now we're pushing digital surveys to them, and they're tearing through 40 questions in depth and getting them back to me.